I use amniotic membranes in my practice, and I have a specialty contact lens practice. So what I like to do is rejuvenate the surface of the eye first. So a patient who has GVHD or persistent epithelial defects, what we do is we want to heal that surface first. And it may take about a week or two because the amniotic membranes heal those corneas really well fast. And then I'm able to apply contact lenses onto that patient. Amniotic membranes has really helped me grow my practice because not only other ODs and optometrists, but even the ophthalmologists are referring patients here who has ocular surface disease. These patients have been on a lot of medications, drops, steroids, cyclosporins, and it's not getting any better. So what they do is they recommend patients come over, get an amniotic membrane, and then we kind of take over care with them and we co-manage well with these patients. So now we're getting a lot of referrals, not just from fellow ODs, but also MDs. When placing a dehydrated amniotic membrane, it could be a little tricky at first, but after you do about 2 to 3, it's going to be a piece of cake. It is very comfortable for the patient. They say they feel so much better, they don't have to worry about cosmesis, and it's overall comfortable compared to the frozen membrane. The shelf life is about 5 years for the dehydrated membranes. If you get the frozen membranes, it's usually about 6 months. So we constantly have to have someone do an inventory, going in and see what the expiration dates are for the frozen amniotic membranes versus the dehydrated membranes. When it comes down to getting reimbursed for these membranes through medical insurance, it's actually really easy, and the best part about it, I used to use and I still have it in some cases, the wet membranes, but with the dehydrated membranes, they do cost less, so you don't have to be as concerned, and the reimbursement is at the same amount. I would highly recommend you get them because you never know what walks into your practice. So just the other day I had a patient who had a huge corneal abrasion. They went to the hospital, they came to my office. The hospital actually put them on proparacaine, which made everything worse. He was in a lot of severe pain, and I was able to grab a membrane that I had on hand. If I didn't have one, I would have to refer that patient out to a different practice. So I would say to any ODs who are thinking about it, again, highly recommend that you get the membrane, have it on hand, because you never know what walks into your office.